to Good Morning Arkansas. Dr. Michael Spann is here to answer all of your plastic surgery questions. Thanks for being here.
Yeah, thanks for having me.
Good to see you.
Yeah, you also.
And you're here with Little Rock Plastic Surgery. I'm sure you get lots of questions.
Yes.
But we're going to take our callers' questions first. Here's Toby from Little Rock. Hi, Toby. Thanks for calling. What's your question?
Yes, I've heard in the past of like famous people having surgeries go bad. What's type of credentials should you be looking for when you're looking for a plastic surgeon?
Good question. Did you hear it?
Yeah, absolutely. That's a great question, Toby. I mean, the biggest thing that about credentials and qualifications is look at the training of the surgeon. A lot of us are trained and qualified by the American Society of Plastic Surgeons and board certified in plastic surgery. That means we've usually done some type of residency, such as general surgery, and then went on to do a credentialed residency, such as myself, with plastic surgery. So, important thing is look at where your surgeon's trained, and specifically look at where they're operating at too. You want to make sure that somebody's operating in a facility that is accredited.
Always good to go in with a list of questions.
Absolutely, and it never hurts to see multiple surgeons if you don't feel comfortable with the credentials of this person that you're seeing.
All right, thank you so much.
Thank you, absolutely.
Thanks for the question. Coming up, our next question, Suzanne from Holly Springs. Hi, Suzanne.
Hello.
Thanks for calling. What's your question?
I am going to have a consultation shortly. My family doctor wants me to have breast reduction. I have a lot of trouble with my neck and everything. I'm very large. And my question is, I don't know how much I should go down, and is it a lot of pain? Because I'm a chicken.
Well, naturally, Suzanne, with any surgery, there's going to be some element of discomfort early on. I mean, the thing about breast reduction, for us as plastic surgeons, is one of the most rewarding ones. We have almost a 95–98% satisfaction rate. The key with reduction, we have to look at, is this a cosmetic reduction or is this an insurance reduction? Sounds like your doctor is probably setting you up as someone who qualifies for insurance. With that, your company's going to have some criteria that we're going to need to meet to fulfill the insurance requirement. As far as how far we go down, it's typically something depending on where you're starting and then fit it to your body type and to where you want to get to. I mean, the thing about breast reduction, it's rare to take too much. Usually it's any little bit will be good, but it's important to talk to your plastic surgeon about what size you would like to be afterwards.
And how much can it help with neck pain? Because it sounds like that's the issue she's having.
Right, a ton. I mean, this is one of the surgeries that we see almost immediate results. I'll have patients in the recovery room saying, I can't believe I've done this. I can't believe it feels so good. I should have done this sooner. That's one of the most common reports we get from breast reduction.
Great, great. Well, thank you, Suzanne. And the next caller is Angie from Little Rock. Hi, Angie. Oh, Teresa from DeWitt. I'm sorry. Hi, Teresa.
Hi, how are y'all today?
Good, good. Thanks for calling. What's your question?
Yeah, recently I have lost a lot of weight. I have been considering, I lost a lot of weight in the breast area too. That's the main thing that's bothered me. I'm considering implants. Are they as real feeling as the normal breast would be, and how expensive are they?
That is a great question, Teresa. First, congratulations on the weight loss. I know how hard that can be. Trust me, we all deal with it at some point or another. What happens when you gain weight and then lose it is basically the skin loses its resiliency and you wind up having a lot of loose skin. When we evaluate people after massive weight loss or post-bariatric surgery, we're looking at what type of skin tone they have, and then specifically in the breast, we're looking at the position of the breast, the shape of the breast. Implants are a great way to replace some of the volume in the breast. A lot of times, though, people are going to want to add a lift or something to kind of reshape the breast and restore some of the fullness. As far as the implants, there's two different types you want to look at, saline and silicone. Of the two, silicone is going to feel much more natural. And there's been a lot of talk in the FDA recently about the safety of silicone, which we're seeing is a safe product at this point. As far as the cost, it's going to differ between surgeons and where you go. I mean, there's a lot of variability, so check with the surgeon as far as what they're going to ask for that.
All right, great question. Also, Angie from Little Rock. Hi, Angie.
Hello.
Hi, thanks for calling. What's your question?
My question is the difference between tummy tuck and lipo. I don't know how do you all figure out which way to go? That's my question.
Great.
Right. And that's a really good one. What we see is lipo is going to be less invasive. And so if we have a person who has a little area of just kind of pocket of fat, some localized area of fat with not a lot of loose skin, perfect liposuction candidate. Typically, when we see a lot of loose skin, especially in the mid and lower belly section, lipo's not going to do a lot to restore the skin tone. And so we're going to have to do something to remove some of the extra skin. That's where you fall into tummy tuck. The easy trick is to just pinch your skin. If you could pinch about 4 or 5 inches of that, then that's a tummy tuck. If it's very firm, typically that's going to be lipo. That's just a crude measurement.
Wow, I thought those words were interchangeable. So I'm so grateful that you're here with all those all that great information. And we had such a great variety of questions today.
Oh, that's great. Yeah, absolutely.
And you are located at 2200 North Rodney Parham. And if people have any questions or interested in plastic surgery, they can give you a call, 501-219-8000. All right, Dr.
Thanks so
Spann,
much.
Thanks so much for being
Absolutely.
here.
Thank you, Stephanie.